A title: The Role of Medical Records in an Elder Abuse Case. A disclaimer: the opinions, findings, conclusions, and recommendations expressed in this program are those of the speakers and do not necessarily reflect the views of the U.S. Department of Justice. This project was supported by the U.S. Department of Justice's Elder Justice Initiative and the Office on Violence Against Women. Portions of this program are protected by copyright. If you would like to copy, display in a public setting, adapt, or distribute this program, please contact elder.justice@usdoj.gov.
What sort of medical records would be helpful for a prosecutor to have in examining whether elder abuse had taken place?
Dr. Anthony Rosen, emergency medicine physician, New York Presbyterian/Weill Cornell Hospital, New York, New York.
I would think there are some critical records from the hospitalization, or at the very least the emergency department visit, when the abuse was detected, that I think would be critical for the prosecutor to try to find. The first would be any records from the physician, any physician notes that they might have from that hospitalization, any emergency medical services notes from the ambulance that brought the patient to the hospital, any notes that describe lab tests or radiographic tests that were done during the hospitalization, as well any psychiatric tests or psychiatric evaluation that was done during the hospitalization, and also any social work notes, or any time that a social worker evaluated the patient or evaluated the circumstance. So from my perspective, and I know for prosecutors it can often seem like sort of a couple inches of paper, I would say that a comprehensive medical record from the time that the patient presented to the medical system when the abuse was detected is critical in helping to evaluate whether abuse occurred and to try to support the findings that the initial clinicians based their decision-making on. In addition, Rhonda, and from my perspective, of course, this is more challenging for prosecutors. I would say that in my experience working with prosecutors and evaluating cases, sometimes medical records from even months to years before abuse was detected and months to even years after abuse was detected can be helpful. Let me give you a few examples. If, for example, a patient looks like they're cachectic, like they are very underweight, it would be very useful to know if they were also underweight 6 months ago or if this represents a precipitous decline in their weight. If a patient after, for example, they were treated acutely in an emergency department or hospital for injuries that were suspected to be due to abuse, was then moved to a nursing home, it would be helpful to know how their care proceeded in the nursing home and how their health improved or didn't improve. And so I would encourage prosecutors to be as proactive as possible. Work closely with your medical expert and offer to get other medical records as they might want, and even offer, say, hey, gee, do you think if I was able to get medical records from the primary care physician, do you think that would help your interpretation of this case? If I was able to get medical records from a nursing home stay after the hospitalization where the abuse was detected, would that be helpful? Are there other records that I can get for you to help? I think sometimes even the medical expert might not think about things that can be helpful until the prosecutor suggests it. Ultimately, we're doctors, and we want to learn about the longitudinal care of a patient. And the more we can learn, the better a picture we can understand of the patient's care and the better picture we can paint, if necessary, in a trial for what type of care the patient experienced before the abuse was detected, when the abuse was detected, and perhaps what kind of care they received even after the abuse was detected. And so from my perspective, I know this isn't always particularly helpful, Rhonda, and I apologize to you and to the prosecutors that are watching, but I would say more is almost always better. Unfortunately, what that means is that doctor colleagues like me have to go through several inches of paperwork, but often it's in those inches that are the key things that we're looking for to help you interpret what's happened.
Kathy Van Olst, Senior Deputy Prosecuting Attorney, Seattle, Washington.
We would collect medical records that go back and are able to identify when some incapacity may have started, dementia may have begun. Also, what medications the individual victim is on. Those things are all very important for the jury to hear, that this isn't something that we are arguing just to them, but it is something that our victim has lived with, and this progression has occurred over time. Also, in our sexual assault cases, those medical records may show that there's some sort of pattern. If this is a case, say for instance, involving a longer-term relationship, you may see incidents of physical violence as well, some bruising, especially bruising in particular areas of the body that you wouldn't anticipate, such as the trunk or the thighs. All of that information is corroborative of the fact that a sexual assault occurred, and that's critical information for the jury.
Dr. Veronica Lofaso, Director of Geriatric Medical Education, New York Presbyterian Hospital / Weill Cornell Medical Center.
Physician's records, not just the physician's records, but the nursing records, because the nursing records is where you really see the best documentation of pressure ulcers, of skin care, of what the person actually looks like, the hygiene, because the nurses are really on the front line seeing these things. Social work notes, because the social worker is going to go back and dig and find that, oh, this person has actually been admitted to 3 other hospitals with falls and fractures. They're going to do that kind of background work. Geriatric psychiatry notes can be very helpful to help us decide the capacity of the person and things like that. Radiology, all of it really, again, I hate to keep repeating myself, but this putting together a picture, I'm really finding the more I do this work, the more you need all of these pieces to come together before you can see clearly that this is really a problem.
Now, Laura Mosqueda, Professor of Family Medicine and Geriatrics, Keck School of Medicine, University of Southern California, speaks with Paige Ulray, Senior Deputy Prosecuting Attorney, Seattle, Washington.
One important lesson for prosecutors is the way you sent me those records. That after we had that conversation, there were a couple things that made my job much easier, which is one, you were very clear on what you wanted from me. You were very clear on questions. So I still remember I had Post-it notes with like the 4 central questions you had, so that I could always go back and focus when I was doing the record review on those questions. Because it's easy for me to get distracted by all the other medical issues that I could see. But I knew what you needed in terms of the prosecution. That was hugely helpful to me. And the other thing, just at a logistical standpoint, is you sent me the most organized set of records I could possibly imagine. So they were big binders, but they were tabbed. There was a table of contents. They had the volumes listed, so that when we were reviewing things on the phone, we could very quickly and efficiently get to the information that you wanted to. It was this volume, this page number. I've had some circumstances where people have sent me discs of all the medical records, which I understand is much easier for prosecutors, but they've been pages have been turned every which way. I can't find anything. This was, to me, was a beautiful example of how you made it much easier for me to try to be helpful to the case. And one thing I like to be mindful about is just the expense of hiring somebody like me and trying to be as efficient as possible. So focusing in on the records that were really most relevant, holding some of them off, knowing that they were there and available if I needed them, but not delving into them and taking all the time it would take to look at them carefully if I didn't think it was relevant to the questions you were asking. So again, back to knowing what you wanted also, I think, helped me be more efficient and cost-effective.
Logos appear. NCAL, www.ncall.us. Terra Nova Films, terranova.org. Funded by the U.S. Department of Justice Elder Abuse Initiative and the Office on Violence Against Women, www.justice.gov/elderjustice.